Welcome, everyone. Thank you so much for coming today. I am very excited to present our adhesion webinar. The first thing I want to do is pull up our disclaimer because we are on a Zoom recording, and let me pull that out. This online event enables an attendee to participate through a personal device, microphone, and/or camera. An attendee may elect not to participate through use of a microphone or camera. The election of the attendee to use the microphone and/or camera constitutes a release and a waiver of rights in the captures of the attendee's images, likeness, and/or voice for the exclusive privileges of Clear Passage Physical Therapy. So just like any other Zoom or webinar that you have been on, we're going to be recording this and we can share it. Just wanted to let you know about that. And I will show you the slide. Before we get going, I would love to hear about you. Where are you from and what are you expecting out of today's webinar? And so I'll put it in the chat. So I just put mine in the chat. I'm from St. Louis and I would love to connect with you. And I really want to make sure you come away with some good understanding of material for your health. So just put your information in the chat, maybe where you're from and what you would like to get out of today. And that would be wonderful. And then the other thing is if you have any questions during this webinar, you are more than welcome to raise your electronic hand and we can answer it towards the end or put it in the chat. And as we're going through or actually towards the end, we'll be more than happy to look at it and answer those questions. Okay, so let me go ahead and screen share again. And go to slideshow. And start from the beginning. You just heard our disclaimer. And then, Heather, I'm going to have to give you controls of the slide because it's not letting me do it. So if you can go to the next slide. If not, we will just go ahead. There we go. Welcome to the adhesion webinar. And again, any comments or questions, go ahead and put them in the chat and we will get to them. And next slide. So I am Sharon. I am a physical therapist and a massage therapist. I graduated from St. Louis University in 1992. I graduated massage school in 1999. What does this mean? It means that I have a very, very deep understanding of tissues. I have over 20,000 hours of manual therapy. So 10,000 hours of any specific skill usually creates an expert. So I've just been around a long time. 20,000 hours just means I've been around a long time. So I've seen a lot of patients. I've treated a lot of tissue issues, helped tons of people, made lots of people pregnant, decreased a lot of bowel obstructions. So we just have a lot of manual therapy experience. In addition to the manual therapy, the Warren technique or clear passage requires all of the therapists to have an extra 100 hours of training for the Warren technique. And finally, I am not only a treating therapist for Clear Passage Physical Therapy, I'm also their chief operating officer. Next slide. So what are adhesions? In fascia, and fascia is a three-dimensional organ. It's around every tissue, every cell, every nerve, every organ, every muscle, every bone. So it's three-dimensional. And I'm going to quit screen sharing here for a second. All right, so it's around everything, right? And so adhesions, scars form in fascia, which is a very, very, very healthy thing that happens because we want things to bond together. Because fascia is three-dimensional, when we start to form more scars or that scarring tissue keeps going and going and going, that scar turns into adhesions where it won't let things move. So everybody, if you would, grab on to part of your clothing. So if I would grab down to my hip, you could see it pull, but I'm going to grab at my shoulder. So grab at your hip, grab at your shoulder. When I pull on my shirt, we're going to pretend I'm pulling on fascia. So I have an adhesion here in my shoulder, and it's affecting all of my torso. It's affecting my neck. It's affecting my back, but it's also affecting down in my hip, and it's also affecting down in my low back. So I'm going to stand up real quick. So if I have an abdominal adhesion from a surgery and it's tugging, I'm not going to get any rotation through that pelvic area, through that torso. That adhesion is going to pull into my back. That's going to pull into my other hip. That's going to pull down into my pelvic bowl. That's going to pull up into my chest. So adhesions are three-dimensional structures that bind. Let's go ahead and turn on this PowerPoint again. So we say there are tiny power straitjackets that limit organ mobility, motility, and function, just like I've showed you. Okay, next slide. So adhesions form whenever there is inflammation in the area. That could be because of an accident, car accidents, falls, surgeries. A lot of times when we cut into our abdominal wall or cavity or our low back, adhesions are tentacles that come out and just attach and bear down, are like straitjackets on the organs and surrounding tissues. Infections can cause adhesions, inflammation, traumas of any sort, radiation therapy, or disease processes such as endometriosis, uh, small intestinal bacteria overgrowth is not necessarily a disease process, but it's an infection. Next slide. So diagnoses that we know have adhesions, bowel obstructions. Unless your bowel obstruction is caused by an intercession or caused by tumors, metastases, most bowel obstructions are caused by adhesions that are stopping the material to go through the bowel. And you can see the before and after pictures right here in our bowel. That is a bowel obstruction that you can see. And after therapy, that bowel obstruction has been cleared. Black fallopian tubes is another diagnosis that is caused by adhesions. And you can see right here that there is no flow through the, if you look at the red circles here, there is no flow in this HSG before therapy. And after therapy, look in this green area, it's called spillage. You can see this white stuff come out and you can see it on the images. And that spillage means that your fallopian tube is open because that white stuff came through your fallopian tubes and is now spilling out over the ovaries. And that has occurred because of therapy. Adenomyosis. Check out this uterus over here. Do you see how thin and it kind of looks almost like a Y? That's because of those scar tissues that are just in that uterus and it's pulling it together. And after therapy in the green, you can see where that has opened up and that uterus is very, very broad, wide, and pliable. Chronic pain. A lot of our patients come in bent forward, pull forward because of adhesions. Endometriosis, that is when the endometrium of your uterus comes outside of your uterus, usually through the fallopian tubes, and starts attaching to other organs. It could be the outside of your uterus, your rectum, your intestines. Some people get it all the way up into the top of their intestinal tract. Very, very painful, but that endometrioma then starts to really bind down. So there's no mobility within uterus or the ovaries. Another diagnosis is small intestinal bacterial overgrowth, SIBO. If you have had chronic SIBO, chronic. Now, if you've had it once and you've gone to the doctors and they've taken care of it, that is great. But if it keeps coming back and keeps coming back, we think what happens is that the infection is burying deep into your intestinal tract, almost within these scar tissues from the inflammation from the infection. And so then with therapy, we open up that scar tissue to allow the medicine to go in and help clear out the SIBO. So those are the diagnoses for adhesions. So do I have adhesions? Most everyone has adhesions, but they're functional. If you have adhesions, if you have blocked fallopian tubes, endometriosis, bowel obstructions, if they're not tumor related, if you've had surgeries, we see lots of people with C-sections and hysterectomies, radiation. So let's go ahead and check out our abdomen and see if we have adhesions. So put your hands on your tummy and you can just kind of feel with your fingers. Is my tummy deep down inside? Is it mobile? Can I push it from one side to another? Now, if I get a little bit of a push, you're tight. And so the inside of our abdominal cavity, we'd like to have it move around and glide, right? We want the intestines to glide over the uterus to glide on the rectum, our bladder to glide on the intestines. We think about it as a bowl of warm spaghetti noodles. So everything's just gliding away. When we have adhesions and scar tissue, that really nice gliding turns into more of a ball of cold spaghetti noodles. Like you put them into the refrigerator and when you pull them out, they just don't move. So that's the difference what we want to feel on the abdomen. Sink your fingers deep in, and if everything is really hard, you probably have adhesions. If it doesn't move, you probably have adhesions. If it's just really, really tender, you probably have adhesions, especially if you had those diagnoses that we've listed earlier. If you're gliding pretty well, you're pretty good. Now, before we say to ourselves, I don't know, I just don't know, there was a physician that I know, I published papers with him when we published some research papers together. And he says, okay, I really want to feel these adhesions that we're talking about, because he could see them on scans. He just couldn't feel them. So I asked one of my patients, can we come in and feel one of your adhesions? Sure, sure. So we come in and the doctor, who's been in practice for over 40 years, goes in and he's trying to feel and he's trying to feel and he's trying to feel. And he finally went, I can't feel it. And then I realized, it's because I'm a physical therapist and a massage therapist, and I have tens and tens of years of practices that I can feel these adhesions. And he is a doctor and a surgeon. And he can't feel them, but I can't do surgery. So it's not that he's a bad person, he just didn't have the skill set. So don't worry. The whole purpose is don't worry if you can't feel them or you don't know. You don't know. Okay, let's move on. So we think we have adhesions. I'm not sure, but there are things I want to try. These are some stretches that help with abdominal adhesions. I saw a video from a lady who was talking about abdominal adhesions, and she gave out some stretches, which I really, really liked. What I didn't like about how she taught them is she talked about bouncing into them or fasciculating. When you're going to do a stretch, go into the stretch and hold it for at least 2 minutes. You can go up to 5 minutes. What we are trying to do is take that fascia and pull it and stretch it, right? Because that is where our scar tissue is at, right? Our scar tissue is in fascia, and we're trying to pull it and stretch it. So if you prop up on your elbows, it stretches out that anterior trunk, the front of you. If you lay over a ball, it's called supine over a ball, but you lay over a ball. One of my clients this week said, I teach this exercise laying over a pillow on the bed. And one of my patients came in and said, I tried it over the ball. I actually like it better over a pillow or over a yoga block. So use your imagination. You can do the ball, you can do a pillow, you could do a yoga block, but just something that's going to bring some extension or opening up of the trunk. I had another patient a couple years ago, and this was great. She laughed at me. She goes, I've been doing this already. I'm like, you have been? She says, yes. She is an avid gardener, and she had bags of mulch stacked up on each other. And she says, I just looked at them and I thought to myself, it would feel so good if I could lay over the mulch and open up. So that's how she does these exercises. I love it. I think it was great. And the third exercise is that lower trunk rotation, because remember, if I'm pulling in all directions, that lower trunk rotation, put your knees together and bending them to one side and holding it again for 2 to 5 minutes without bouncing, just holding it and stretching, is going to stretch that whole side of your trunk. It can stretch your hip, it can go into your leg, it might even stretch into your arm because it's all connected. Okay, let's move on. So how does clear passage help abdominal adhesions? Well, Larry and Belinda Warren formed Clear Passage, and this is the picture of them. They got married, and Belinda found out she had cervical cancer of her uterus. And treatment at that time in the late 80s was taking a rod of radiation, putting it in the vagina, and having it irradiate the entire area. So after 14 days, she did not have cervical cancer anymore. What she did have was an irradiated pelvis. And over the course of a couple of years, it became so painful because all of that radiation created scar tissues, and that whole pelvis was locked down. Nothing. And she literally, she quit work because she was in so much pain. But because she was a physical therapist, she was going on with her Con Ed classes. And somebody was saying, well, try this and try that. Well, she was bringing this back home to Larry. So Larry and her kind of developed a technique that started to get deep inside her pelvic floor where nobody was touching, where nothing was helping, and started breaking up these adhesions. Eventually, through their work, Larry became a massage therapist. Belinda was a physical therapist. They opened up a clinic to deal with chronic pain. And they were using this Warren technique because it's the only technique that goes as deep, deep, deep as you can and pull these scar tissues open. Why they were in this chronic pain clinic that they were working with, they've had numerous people come up to them and say, I got pregnant and I don't know why. They told me I'd never get pregnant again. Somebody said my fallopian tubes were open. Eventually, a doctor from the University of Florida called them and said, you just saw one of my patients. Both of her fallopian tubes are open and they were blocked 2 months ago. The only thing we can think of is what you are doing. And you are doing things with your hands that we can't do surgically. But we need to go ahead and start documenting this, and we need to start having research. So that is how the whole research started with Clear Passage. So they closed the chronic pain clinic and opened up Clear Passage, started doing the research about adhesions and abdominal adhesions and bowel obstructions. And they have helped literally tens of thousands of people. So what is the Warren technique? The Warren technique is not visceral manipulation. I'm even hesitant to say the words. I am trained in 3 VMs, 1, 2, and 3. It is not VM. VM is really, really light, and it doesn't get down to the levels of the adhesions. It is not myofascial release, because myofascial release gets in there and cools for a couple of minutes, and it might release something in your hip, but we have found that it takes 16 hours of therapy to really release the entire abdomen and to make people function. What Larry and Belinda developed is a technique that goes deep, deep, deep into the abdomen. It stretches these adhesions, and obviously it's over time because we need 20 hours. And what happens is in the fascia is made up of collagen and elastin. So the elastin is like elastic in a rubber band, and it moves, right? It allows that. When we have scar tissue, that elastin, I should say, in the scar tissue, there is more collagen than elastin, so it doesn't. With Clear Passage, with the Warren technique, what happens is we take these adhesions and we put them on stretch in all sorts of ways, really, really deeply. And it's like taking a rubber band. You know how if you take a rubber band, you just stretch it like this, right? You come back and it's still the shape of a rubber band. So somebody says, I've been to myofascial release and it hasn't helped. How are you different? I think to myself, well, it's because myofascial release, stretched it. But fascia keeps going back to how it's formed. With the Warren technique, we are taking that fascia or that rubber band and we are stretching it. So elastin can lay back down into those collagen fibers. So it's like taking a rubber band and holding it open for 4 hours a day. When you let go of that rubber band, it's going to be wider. It's going to be more elastic opposed to that. Also think about, I love this analogy. Do you remember when you were in high school, you would take shirts or shorts and put them over chairs to stretch them out? Kind of the same idea. We're taking them and we're stretching it out and holding it over time, which is very different than all the other techniques out there. So then at the end of treatment, things are actually just stretching. And so after treatment, we notice that you're not a bowl of cold spaghetti noodles, so things aren't bound up. After treatment, you're gliding because we put more elastin into the fascia so your organs can move on each other. Another theory of why clear passage works is because we are breaking the bonds off the insertions of the adhesions. So the adhesions are tentacles that go out into the abdomen or anywhere where you're have scar tissue at, but we're talking abdomen. So it goes out into the abdomen, they're tentacles, and they lock down. They could lock down on another muscle, they can lock down on an organ, they can lock down on a bone, they can lock down on a nerve, but they wrap around all of this. So with therapy, what we're doing is also breaking these adhesions off of their insertions, which gives everything a lot more flexibility. All right, I'm going to go back to screen sharing. And again, if you guys have questions, let us know. Next slide. Yep, questions. See? Okay. So I'm reading in the chat, we've got somebody from St. Louis. Hi, you're next to me. I'm so excited. Yes, and if you want to set up a conversation about your options, that'd be great. Shelley says, is this technique safe for patients with a stoma and those who've had peristoma hernia repair with mesh? Yes, so I have treated a lot of people with stomas. Before we get into the hernia, uh, we have a relationship with Ostomy Magazine, which is a stoma magazine, and it is very safe for anybody with stomas or even if PICC lines. We treat people with G tubes, venting tubes. We sometimes treat people who have very, very, very complicated issues. If you have a hernia, and it sounds like you have a hernia repair, if you have a hernia, we take note of that and we really stay away from the area, or when we treat the area, we treat it so we don't open the hernia, but we work underneath the hernia, keeping it, not stretching it anymore. You have a hernia repair, so it won't affect treatment as much. So yes, can we treat with a stoma? Absolutely, do it all the time. We can treat with a G tube and a venting peg, any other tubes that go into the abdomen. We treat very, very complex clients. We treat pretty easy clients. How often does one have to do this treatment? Clear Passage has done research and has shown that treatment is effective after approximately 16 hours. That's where people get the most benefit. So we have developed a 20-hour treatment program. So that gives us a couple of hours for an evaluation, a couple of hours for a home exercise program, meaning you are going to go home and you're going to know how to treat yourself. So you don't have to keep going to therapist to therapist, to doctor to therapist. Because if you're going to another doctor for surgery, that's going to eventually cause more adhesions. But the question is how long? We have a 20-hour program. Most people fly in to see us. Most people see 4 hours in the morning or 2 hours in the morning, 2 hours in the afternoon, and it's a week-long therapy program. If you live close to our locations, which is UK, London, Florida, New York, Metro Detroit, so just north of Detroit, Metro St. Louis, Dallas, and Reno, you are more than welcome to spread it out over a couple of weeks. I don't like to go longer than 3 weeks. Most of my patients would stay within that 2-week time frame because, again, we want that time to keep following up with you. If I see you every week for 20 weeks, you keep rebounding back to where you were at. Your fascia keeps rebounding back to where it was at. So we'd like to keep that 20 hours in 2, possibly 3 weeks. If 90% of small intestines have formed into one large mass, is this even an option? we would really have to discuss that because I have treated 3 clients who've had the HIPEC procedure, and that is where if you've had cancer in the abdomen, they put chemotherapy in your abdomen and they shake you kind of like up and down. It really helps, does wonderful with cancer. What happens is it kind of makes the stomach a mush ball. And it's formed adhesions, so everything is tied together, but we're not sure, as I'm talking to the doctors, if that's just all scar tissue, which we could help, or if there's been chemical changes because of the chemotherapy that have now made them adhered and one with each other. So it would really depend on why your 90% of your abdomen or small intestines are formed into one large ball. Is it because of surgery? Absolutely, we could help. I saw somebody who's had 24 abdominal surgeries. Crazy, I know, crazy. And his abdomen was one big ball. Endometriosis. People come in after an endometriosis surgery or before an endometriosis surgery, and their abdomen is one big ball. If you had the HIPEC procedure and you've been through chemotherapy, I would say, let's talk about it. We've had success with some people and not success with others. Let's see. You're welcome, Shelley. I've had 5 surgeries for endometriosis, adenomyosis, and fibroids, and the last of which was aborted because I have frozen pelvis. Is this treatment safe for me? Yes, as long as you don't have any of the other, we make sure you don't have a bleeding disorder. We make sure you don't have a lot of hernias, as we were talking about before. We make sure your health is good. If you, I don't want to say just had 5 surgeries, but remember I've treated somebody with 24 surgeries. If you've had surgeries and that is the only issue per se, or endometriosis and surgeries, absolutely this treatment is very safe for you. But we fill out a medical history form. If you're even remotely interested in coming in, you fill out a medical history form, and one of the therapists, myself or one of the other therapists, goes through that medical history form and sees if you are a good candidate, if therapy will help. Okay, and Heather wrote in there all of our locations. Thank you, Heather. Privately to me, my son did 9 hours, but it was getting incredibly painful, so he decided to stop. Should he try again? Interesting. When I treat children, I usually treat 2 hours a day over 2 weeks. It shouldn't be incredibly painful. So I would say call the office and let's talk to a therapist. There are some therapists that do very, very well with children. I know I really like treating children. So it's just a matter of listening to their bodies and letting them respond. Let's piggyback on it's incredibly painful. This therapy should not be incredibly painful. I tell my patients, and I even tell people even before I see them, what we like to do is stay on a 6 or a 7 out of a pain scale out of 10. So your neurological system can actually relax around the treatment. If you are constantly tight and fighting me, and I'm trying to push on you and you're fighting me, all we're doing is creating more tension, which was what we're trying to get rid of. So treatment truly should not be incredibly painful. If my client is tightening up on the table, is starting to squirm around, we find a different way of getting to where we need to go. We really kind of sneak in underneath the pain alerts. So we can do some really, really deep pressure without making without making the client painful. And so even as I think about this, all my kiddos that I've seen, we've had mom and dad entertain them. We've had uh, narrowed treatment down to, like 2 hours or 1 hour in the morning and 1 hour in the afternoon. And none of my kiddos were squirming away because of pain, squirming away because, they wanted to be by mom, squirming away because, okay, it's been 45 minutes, I want to be doing something else. But there's ways to treat kiddos, and that's having mom or dad in the room all the time and letting them hold on to them. There's lots of ways to treat kiddos. So to answer your question, we can treat kiddos. To answer the broader question of, is this painful? It shouldn't be. It should be 6 out of 7 out of 10 out of pain. You should be able to talk through treatment no matter what your diagnosis is, no matter how complex you are. Somebody was saying their general surgeon does not recommend another surgery because the risk is too great. The purpose of the surgery is to complete IVF. If I do treatment, is there a possibility I can do another surgery to complete IVF? Okay. I think I missed part of a post here. From yes, because you had 5 surgeries already. So if you do this surgery, actually, it will increase your chances of IVF implantation if that is what you're thinking of going towards. And we have research on that. Go online and look at it, or call the office and we can send you some information about that. But we do have research about how it actually increases implantation rates for IVF. If you decide not to go IVF, we have a success with most of our patients getting pregnant with naturally. So depending on what your medical condition is, can we do IVF afterwards? Absolutely. Can I get pregnant naturally afterwards? Absolutely. And by the way, we've had over 1,000 babies born to clear passage babies. Just 2 very recently in St. Louis. It was fun. Is this painful? I've already answered that. If I have adhesions with spinal cord and spine is unbendable, can this be accomplished without trauma to the spine? Yes, yes. I also have a spinal cord stimulator in place too. It's a bit complicated. And it was because of lots of surgeries. So I don't know your entire medical history. So I can't say, oh, you are a perfect candidate, because I haven't looked at your whole medical history form. But to answer the questions, can I be treated with a medical spinal cord stimulator? Depending on where it's at, yes, we would have to know where it's at. Do we keep it on or keep it off? I personally have treated people with a spinal cord stimulator. Heather put in there our medical history form, so if you want to click on that link, you are more than welcome to. Would your organization also speak with the patient's doctor in addition to the health form? If the patient's doctor would like to speak with us. So a lot of times patients want us to speak to the doctors, but the doctors are very, very busy. But yes, if the doctors would like to speak with us, the treating therapist would be more than happy to. If you're trying to figure out or if the doctor's trying to figure out if this treatment's good for you or not, because I'm the chief operating officer, would be more than happy to speak with that doctor. Um, um, so Emma was saying his pain was worse after therapy, but not during therapy. Yes, so that's just something we would have to keep working on. And if the 9 hours helped, then the additional hours would be of benefit. All right. Is there any other questions? You're very welcome. So Heather put down in there our phone number. And here I'm going to share our slide again with you. And I'm going to ask Heather to go to next slide. So attending today, you are going to receive the ebook link to Adhesions. It's free, the book, The Body's Hidden Menace, so you could go ahead and just learn so much more. So you can make it a very educated decision of how you want to move forward with your treatment and your life. If you want to put your email in the chat, Heather will make sure she gets it to you. I think we're also going to send out the ebook to everybody who signed up for this webinar. If we decide to do another future master class, you would receive 25% off future special master classes. So these are our two gifts. But the question is would anybody be interested in a master class, such as a class in bowel obstructions, a class in endometriosis, a class in blocked tubes? So if you would be interested in any one of those classes, please put that in the chat too, so we can gauge if people would even be remotely interested in another class dealing with very specific diagnoses, or if we like this format of just adhesions better. Does age or weight hinder treatment? We do ask for our therapist hands to have a BMI of under 36. However, with that being said, each therapist can say if somebody comes with a BMI over 36, if they will agree to treat them. And we figure all that out even before you go to therapy. So put your medical history form in, and if you have a BMI of over 36, we need to have a discussion. Age, we've treated literally babies, crying babies. They've had surgeries right out of in utero. So they've had surgeries just after they were born, all the way up to, I think we've treated people in their early 90s, as long as you can get to the clinic, you can transfer by yourself, you can get up on the table, you can move around. So those aren't age related per se, those are mobility related. Okay, Heather said she will send the recording and the ebook to everybody who signed up. So you get that free ebook. Thank you, Heather. Okay, we've got somebody who's interested in bowel obstructions, bowel obstructions. Okay, so some people want a class on everything, but I think it looks like bowel obstructions are winning. Excellent. All right, I thank you, first of all, for coming out and spending your Saturday morning with us. I know we said it was only going to be 30 minutes, and we've worked into our 43 minutes so far. Feel free to go. You don't have to stick around, but is there anything else I could answer for anybody before we sign off? Yes, I'm grateful too. I am very grateful you all came. If you have any questions, feel free to email the office. Feel free to call the office. If you want a conversation with one of our therapists, we'd be more than happy to answer. All right. Have a wonderful, wonderful Saturday. I truly hope that you have the answers to move forward with how you want to take care of your health. Good luck to all of you.